So, doctor, as you have already mentioned in the starting, that kidney disease progresses silently. And at what stage do most patients come to you? And what challenges you face at the later stages when patient comes?
See, when we say that kidney diseases are silent, what exactly we mean by this statement? Majority of the kidney diseases means that we have a chronic kidney disease. That's where we label. It has a huge tendency. Even if somebody, say for example, there's one marker of the kidney which we call as a creatinine test. Even if the patient is having a creatinine of 3 or 2, he may not be feeling any problem in his body unless until you have done a blood test which has picked up the creatinine level is high. Another thing is that you may be losing lot of proteins, lot of sugar in your urine. You may not be even aware of that also. You may be silently having an anemia. You may be silently having excessive fatigue. You may still not be aware that you are having a kidney disease. That's why we call it as a silent. The diseases are mostly at silent unless until you are being evaluated by a physician. In my clinical practice,
Yes.
in my clinical practice, we receive, responding to your question, we receive majority of the patients who are really not aware about that they are suffering from the kidney diseases. So that's why it is mostly the silent. And we find that always the patients who are having a chronic kidney disease, they reach to us in at least stage 2 and stage 3. Unfortunately, few of them may also come in stage 4 or 5, which we call as a end stage renal disease. And at that time, no medical management or treatment is possible except, doing a renal replacement therapy.